Please welcome Trieu from OUCRU.
Hello everyone. Have you ever experienced high fever, muscle pain, and rash, and the doctor said that you get dengue infection? I believe several audience here would say yes, because dengue infection is very common in Vietnam and in other countries. So this is one of the most common viral infections, rapidly spreading more than 100 countries in the world. And the virus transmits from human to human through the mosquito bite. And somebody gets dengue infection will have several symptoms like high fever, muscle pain, abdominal pain, vomiting, but that's not so serious. And the worry complication and make the patient die are bleeding and shock. The patient with dengue infection can have bleeding anywhere, from the nose, from the gum, from the skin. And shock does mean the low blood pressure, so the patient may die because of that. And if you get dengue, the fluid in the vessels, we call plasma, will leak out. That is lower the volume in the body, in the vessel, and make the blood pressure go down. So there's no specific drug to treat the patient with dengue. And the patient, if they develop shock, so the doctor will give fluids into the veins for 1 to 2 days, not 1 to 2 hours. And it's difficult to know how much volume to give to the patient, because if too much volume given, the patient will have difficult breathing and die. If too little volume to give patient, the patient will have shock and die. So it's very difficult test for the doctors. So the current method to monitor the dengue shock patients is quite simple, and sometimes it's not accurate. Just the pulse check, the blood pressure checks, or check the density of the blood from the fingerprints. And sometimes for severe cases, we have to put the long and big cannula into the vein to see how much volume in there. So these techniques can cause pain and bleeding for the patient who already have the risk of bleeding because dengue infection. So it's very necessary to find other methods to monitor the dengue shock patients. So in my PhD research project, I will using different non-invasive monitoring system to see how much fluid in the vessel of the body of the patients to have the better way to manage them. And I hope with the new method of monitoring I'm using, so the patient will have the better outcome, and it's a useful tool to support doctor. Thank you.